Okay, it says that we are live. Happy Wednesday, everybody. Thank you for joining. We'll give everybody just a minute. Thank you so much for joining. I'm so excited about tonight's broadcast and so excited about our guest tonight. We have lots of information, so come on in, tell your friends. We have lots of facts about COVID-19 from a world-renowned specialist, Dr. Joy. So come on in, press like and share. Get someone on the phone, tell them to go to Facebook, either look up Dr. Terralon or look up Dr. Joy and click on our profile so you can get this information. We are so happy to have you here. So thank you all for joining. All right. All right. So happy Wednesday. I am Dr. Terralon, your board certified family physician, speaker, author, and coach. I help medical professionals make pivotal changes so that they can live a life of flexibility, freedom, and financial independence. Please follow me on all social media platforms at Dr. Terralon. That's DrTerralon. Thank you so much for joining. And as you can see at the bottom, please feel free to go to medicalcareerpivot.com to get my free tips and to schedule a strategy session. Thank you guys for joining. I'm so excited. I know you guys are starving for information, and we have an excellent specialist. First, I want to say happy National Women Physicians Day. Today is the 200th birthday of Elizabeth Blackwell. She is the first woman to have received a medical degree. So thank you to Elizabeth Blackwell. Thank you for all those women who paved the way. Now, especially, I want to salute all of the Black women in medicine because we only make up 2% of physicians. So we are like unicorns out there. And I have a fabulous unicorn here with me, Dr. Joy. So let me not hold her off any longer. She's in my virtual green room. So let me say hi to Dr. Joy. Hi, Dr. Joy. How are you?
Hey, Dr. Terralon, thank you so much for having me. I'm so excited to be with you today.
Well, I know you have your own intro, but let me tell my audience who you are because just a little bit, because I want them to be just as impressed as I am. So you see Dr. Joy's lovely face. As I said before, she is a or at least in our announcement, she is a pediatric pulmonologist. That means she specializes not only in the lungs, but in the lungs of children. She has a special interest in kids with asthma. So that means she went to school a lot longer than I did, and she's very smart. She is, for all you Spelman alum, she is an alumna of Spelman College, and she received her medical degree from Howard University. Now, it doesn't stop there because she is a boss. She is chief of pediatrics at Nemours, which is a world-renowned children's hospital in Florida. So she's a boss. And she's also a businesswoman because she has come up with something called the Asthma Kid Care Go Bag, and she'll tell us all about that. So that's what I know of her. So if your mind isn't already blown and if you aren't excited to hear from her, then get ready to get wild. Like I said, like, share, and I'm going to turn it over because I'm already talking too much. So go ahead, Dr. Joy.
Thank you.
Introduce yourself, and we'll just take it from there.
That was a wonderful intro. That's hard to follow up, but yes, I'm a board certified pediatric pulmonologist or lung specialist for kids, and I help kids and their families successfully treat asthma symptoms. And I have a new product out. It's called Asthma Kid Care Go Bag, and it helps keep kids with asthma organized and ready to treat asthma symptoms whenever they happen. You can go to www.asthmagobag.com to learn more and buy one today. And I think Dr. Terralon is scrolling the website down below, so you can take a look there.
Yep, I have it below. So I told you she's a boss, so she's an innovator. So now let's get down to business. So there are a couple of reasons for this broadcast. One is to show all of those medical professionals out there and just anyone, just what you can do with a medical degree. And so I want to start by how that's the first reason. And then two is to bring the information, of course, about what your specialty is and what's going on in the world, which is, of course, COVID-19. But I want to start with, for those people who are interested, because we do have some little ones out there, and, we have some, for that little girl who is wondering, how did Dr. Joy get to where she is? Can you tell us how you got to be a pediatric pulmonologist and asthma specialist?
Absolutely. I'm happy to tell my story. So I have always been interested in science ever since I was a little girl. I love science experiments. I love space. I loved anything that had to do with math. And so I always knew that I wanted to do something that was in the math and science realm, the STEM realm, as we call it now. My mom is a doctor. She is an allergist. She graduated from Howard University. And I graduated from Howard University 30 years after her. So I had a wonderful role model. And I knew that as a doctor, I would be able to help people, that, I would be able to not only enrich myself and enjoy what I did from an academic standpoint, but also that I'd really be able to make an impact in my community. So I knew that medicine was for me. I love kids, and, I've always enjoyed working with kids. And so pediatrics, I recognized early on as the specialty that I want to go into. I decided to do pulmonary, to be a lung specialist, because I'm a severe asthmatic. And I've suffered from asthma my entire life. It's been a challenge. And at times I wasn't the best asthma patient. I didn't always my medicine, but I always appreciated that as a child with a chronic disease, you have to do things a little bit differently. And the doctors that I had were always wonderful and always, bestowed upon me such, great advice to make my life better. I wanted to offer that same opportunity to other kids. So I decided to specialize in pulmonology, and, I love it. I see kids every day who have asthma and allergies, rare diseases like cystic fibrosis. I also work with kids who have sickle cell disease, and they sometimes have lung complications. And certainly, with COVID-19, I've seen my fair share of kids who have pulmonary complications from that as well. So I just want to encourage anybody who's thinking about a career in medicine to consider pediatrics, to consider pulmonology or becoming a lung specialist, because I think it's very rewarding. And I've really enjoyed specializing in both of those areas.
Thank you so much. I mean, I'm so impressed, and thank you for telling your story. I was just gonna check for just a second to see who we can say hello to. I don't know if you can see on your screen, but let me just check and see for a sec if I can see my comments. Sometimes I have trouble, but if not, I'll get back to them. Let's see. Just give me one sec. Well, it always takes me for like just a minute, so they'll come in on my screen. So hi, everybody who I haven't seen yet. I will get to you, and I'll be checking those questions. But we do have a couple of questions that have come in just before I get to the ones that are in the chat. So just starting, because your specialty, you see mostly kids. What are your thoughts about COVID-19 and kids, and what are you seeing? How can we protect ourselves? What advice do you have for the parents out there?
That is a really excellent question. I'm so glad you asked it. COVID-19, we know, has been devastating, and there have been many deaths, lots of heartache, angst. In 2020, our lives were upended, and everything changed. Adults have been really sick with respiratory complications, and unfortunately, there have been a lot of deaths. In kids, fortunately, we have not seen severe respiratory illness or complications or the amount of hospitalizations. However, kids absolutely get sick with COVID-19, and they do get hospitalized. We have seen complications such as multi-system inflammatory syndrome in children, which is a severe complication when you can have shock, multi-system organ failure, fever, and hospitalization in the intensive care unit. That's rare, but it does happen. What I want parents of children to know is that they need to be very vigilant about all of the things we recommend to prevent transmission of COVID-19. Kids need to be hand washing, wearing masks, socially distancing, and if they are sick, you need to keep them at home. In many areas of the country, kids are not in school. In Florida, where I practice and live, I would say about 50% of my patients are in school and 50 in in-person school, and 50% are in virtual school. And we do see in Florida, in the schools, cases of COVID-19 crop up, the schools close, and everybody's worried about transmission. So, I think for those areas of the country where your kids have not gone back to school, it's important for you to know that, of course, there are risks with going back to school, but you can do so safely if you're following those CDC guidelines that everybody knows about: hand washing, masking, being very hyper vigilant about cleaning and minimizing exposures to sick people. If your child is sick, keeping them at home. I have conversations daily with my patients about the benefit to risk ratio of in-person school versus virtual school. It's a very personal decision, but I usually recommend for people who have a higher risk child. And I would say higher risk children would be children with an underlying respiratory condition like asthma, children who have an immunodeficiency, who have been hospitalized for respiratory concerns like pneumonia in the last year, but also kids who might have some of those complications that we associate with adult and high risk conditions we associate with adults, like being obese, having hypertension, having diabetes. A significant amount of my population, unfortunately, has some of those adult issues. Those high-risk kids, too, you should think twice about putting your child in school, and definitely have a conversation with your physician about it. So that was a long answer to your question, but I definitely would encourage people, if you have a child and you're a little bit unsure about COVID-19 and returning to school and some of the complications of COVID-19, talk to your physician.
Thank you so much. So I know that the important takeaway from that was, one, if you have concerns about your child going back to school, one, weigh the risks versus the benefits and talk to your doctor. I think that's really important. It's a very personal decision. It's a case-by-case basis. And then also, the one thing that they're universal precautions for everybody: mask up, wash your hands, and then also teach your children the same thing. And so I think those are probably the most important takeaways.
Oh, yes.
And so finally I have comments. Yeah, I can see them. So I want to say hello to a couple of people who have joined us. So I want to say thank you so much for joining. Sonia, Jeffrey, these are people from all over the U.S. And Kay says hello. She says that she remembers you from here. Kay, you might know her as Karen Torres. Yeah. And thank you, Felicia and Dr. Yes. Thank you, Lauren Wilkes. Stubblefield, that's actually a classmate from high school. So thank you guys for joining. I have family members, cousins. Thank you, Keita Dixon. So we have a wide an audience that covers the U.S. So thank you so much again for all of these great nuggets. Now, there has been a controversy. Well, I shouldn't call it a controversy. I'll let you decide whether it's a controversy. Masks. Now that we have the variants popping up in the UK and South Africa, now we're seeing those variants here in the US. I saw recently there's a debate about 1 versus 2 masks. What's your opinion on 1 versus 2 masks?
So I recommend double masking at this point. The variants that we are hearing about are more transmissible than the standard COVID-19 strain against which the vaccines are directed that are out now, the Pfizer and Moderna and, Johnson & Johnson that hopefully will be approved soon. So, I do recommend double masking. When you think about an N95 mask, it's called N95. It's going to prevent transmission of 95% of the particles. Those types of masks are hospital grade, and so we've reserved them for use of medical professionals, who are highest risk. What we found, though, is that if you double mask, you are going to get more protection. So you should have 2 double layered masks on in order to achieve 85 to 90% protection from droplets and from aerosolized particles that could potentially have COVID-19. So I think, although there is some controversy about it, this is an instance where more is more. And if you're going to be out and about, if you are working in a profession where you have to be exposed to the general public, your child is in-person school, or you're just in a higher risk setting, I would advocate for double masking.
Thank you. Thank you. Now, so folks, feel free to put your questions. I'll be toggling back and forth between 2 screens. So, and I'll try to get to the questions as they come in. Another question, everybody wants to know, with the vaccines that are available, so far, the UK has approved 3. We have 2 right now with the Johnson & Johnson single shot. Hopefully that will be approved soon. And there are more in the pipeline. What's your general recommendation about the vaccine, vaccines, I should say? Everybody is anxious about the vaccines. So take it away, Dr. Joy.
Right. So, we have 2 approved vaccines, Pfizer and Moderna. They're both mRNA vaccines, and they are safe. They are 95% effective against severe infection, and I highly recommend them. I encounter vaccine hesitancy every day, and I have many patients. I walk in the door and they say, I'm not getting the COVID vaccine. And I say, well, that's good to know, but let's talk about it, because these vaccines, I think, are going to allow us to get back to life as we know it. And so I talk to families about what's important to them. Do they want to travel? Do they want to spend time with their extended family? Do they want their kids to go back to school? Do they want to return to work in the same way that they were working before? Our vaccines are our ticket back to normalcy. And so I talk to people about trusting the science, and the science is there for these mRNA vaccines. The mRNA technology has been around for a long time, and I know a lot of people have expressed concern that the vaccines were developed so quickly. Do we really know? Are they safe? Are there unpredicted side effects? Is there an issue with fertility? Are there other issues that are going to crop up? All of these things I've heard, and they're really good questions. And, certainly in our community, there is a good reason to have some qualms about vaccines, given the history of the United States government Tuskegee experiment, which many of us have heard about, and, other experiments on indigenous people. So, I understand in our communities of color and in general, some of the vaccine hesitancy, but I advocate for the vaccine. I recommend both of them. Johnson & Johnson is a different technology. That particular vaccine uses a viral vector, so it's not an mRNA vaccine. As far as effectiveness and efficacy, it's going to be 66% effective for moderate infections and about 80% for severe infections. It is one shot, and so that's the silver lining. And so if you get that one shot, you will be protected in about 2 weeks. That's what they're saying. That's what they're reporting. It's not approved yet, but I anticipate it will be. So I think the bottom line is, if you have a vaccine available to you, you should get it.
All right. So you guys heard it from a lung specialist that you should get it if you are able to. That is the word from our resident specialist. Okay, so we have a comment from Lauren Wilkes Doublefield. She says, now, Lauren and I went to school together. She said, we wear an N95 with surgical masks on our ambulances for any patient with symptoms or fever, and they change surgical masks in between each patient. So, Lauren, I think, if I remember your EMS. Yeah, I mean, this is how serious it is, people. Like some of my people say, the Rona is real. You have to remember.
Yeah.
Okay. Oh, we do have another question. Okay. So, Lakita Dixon Baldwin, thanks, Lakita, wants to know, what are the side effects from these vaccines? So, what are the common side effects?
That is a really good question. So, of course, with any vaccine, you can have injection site discomfort or pain, and that's pretty standard with these vaccines as well. For both of the vaccines, there is a risk of allergic reaction, and that can be mild. It can be hives, it can be a little bit of itchiness, it can be a rash, or it can be severe. Anaphylaxis is a severe allergic reaction where you have swelling of the lips and tongue, and you would need to be observed and potentially use something like epinephrine or Benadryl and just be followed by a doctor subsequently. Overall, there have been something like 77 people who have had a severe allergic reaction to, I think, the Pfizer vaccine, and that's out of, everybody. So pretty low numbers. With the Moderna vaccine, I have heard anecdotally and, in some reports that, have been put out by various physicians that there can be other side effects, feelings of fatigue, headaches, just malaise, and flu-like symptoms after the second vaccine. I have not heard of that as much with Pfizer, so you should be aware of that. And that can just be a sign that your body is actually reacting to the vaccine, that it's picking up on the immunity that the vaccine confers. So I don't know if you would necessarily consider that a side effect or just, or just a kind of a known series of events that happens with the vaccines, but you should be aware of that. I think still the benefit outweighs the risk for the vaccines, but with any vaccine, there is a possibility of allergic reaction or a side effect.
So lots of good questions coming in. Let's see. Okay, Arisha Dancy Maddox, thanks Arisha, wants to know what do you recommend for folks with severe allergies? And you may have to define severe allergies.
Yeah, so severe allergies, are something that I see frequently in kids. Severe allergies can be broad. It can be food allergy. It can be, a prior reaction to the flu vaccine. So it's kind of hard to qualify what type of severe allergy a patient or person has without knowing their medical history a little better. If you have had severe allergy as in a reaction to prior injections, I would talk to your physician before getting the vaccines, just to make sure that they, think it's okay and that you don't need to be observed. If you have severe allergies, as in you sneeze when you go outside and you have runny nose and watery eyes, I think it is okay for you to get the vaccine. That type of allergic response is not going to cause you to be at increased risk for side effects or complications from the Pfizer or Moderna vaccine.
Okay. So Beverly Morgan, thanks for joining. Beverly wants to know, okay. What about the talk and the fact that you can still catch COVID-19 after you have the vaccine? Is that true?
That is a really important question. I'm glad that you asked that. So the vaccine does confer immunity. It offers you protection from infection with SARS-CoV-2 virus that causes COVID-19 disease. It does not necessarily prevent you from transmitting the virus. And so if you are living in a household with a high-risk family member and you've been fortunate enough to get the vaccine and they haven't, you still need to mask. You still need to mask and use all of those same precautions, hand washing, social distancing, all of those same things are still in effect. Now, there has been some recent data that's come out that says that perhaps, after the 2 vaccines, you do have decreased risk of transmitting the virus, but we don't know that for sure. So I would recommend that you continue to exercise all those same precautions that are recommended without the vaccine, even if you've gotten the vaccine. But, take solace in the fact that you are protected against infection, but you want to continue to protect those who have not gotten the vaccine.
So I want to follow that up a little bit and just get your opinion about with the variants that we're seeing, because I don't know, do you know if we have enough data yet because many of these vaccines were done in trials before we started seeing the variants? I think I read today that well, the Oxford AstraZeneca one, they think that that is covering the UK variant, but that's available in the UK. Is there enough data that the Pfizer and Moderna um, vaccines cover the variants that we're seeing now? I know no one died in the Johnson and Johnson trial that was happening in South Africa, I think, but and I know I'm throwing a lot of facts out there, but in general, I'm asking, do we know yet if the current vaccines are covering the variants yet? Is it just too soon to tell?
So, I think there is not a lot of definitive data on that. What I've read is that the UK variant and the South African variant are considered to be more easily transmitted, and they may not be as well covered by the Pfizer and Moderna vaccines. The Pfizer and Moderna vaccines do offer some protection, but those variants that are more easily transmitted may become the more dominant strains, in which case the vaccines that we've gotten, may not offer as much protection. Now, what that transfers into, instead of a 95% protection rate, is it now, 85 or 70? I don't think we know that. But I think the prevailing thought is that we should try to vaccinate as many people as possible before these more transmissible strains become the predominant strains in the country.
And I think what our audience, I know with all of the angst out there, just know that um, just as hospitalists and medical professionals, we see the worst of the worst, meaning we've probably seen, I know that people who've been touched by the virus, you probably know people who've died, but treating physicians in our capacity, I do a lot more administrative work, so I have to read about these cases more, and Dr. Joy has to actually see them more. It is just overwhelming with the way that this pandemic has just ravaged our country and especially our community. So when we say that a few aches and pains versus death, if you are healthy and able to take the vaccines, give me a few aches and pains. I mean, that's just my personal. So that's what I
No.
presented to the patient. And I actually saw a tweet by Plies today who said, well, he's like, well, I trust the weed man. I trust I eat off the food truck. I drink Hennessy. I might as well take the vaccine. I mean, he's like, I trust all of these other foreign things that I put in my body. Why not put it? I was like, why is he speaking more truth than, some people that I know? But
That's
anyway,
what we need. That's what we need. And, I think it is incumbent upon us to find people in our community that are trusted to disseminate this information so that, people take it in on their level, in their context, however we can get it to them. So if it's Praz talking about that, hey, that works for me. If you get the vaccine, I am happy. There's been so much personal pain and tragedy. I've had family members pass away. I think we all know people who have been personally affected by this tragedy, this pandemic. And I can't imagine this continuing in the same way. So I really feel strongly that we've got to take advantage of all of the resources we have to protect ourselves, to protect our families, to protect the life that we had and that we want back.
And I think I've seen it more than actually Dr. Fauci said that we need somewhere between 70 to 80% of the entire US population for us to get back to normal. Yes. So that means you count 10 people in a room, 7 of them need to be vaccinated for for you to go to the grocery store the way you want to without a mask, for you to just get on a plane and go to Jamaica. This is right now, this is our new normal. I don't know. Will we be wearing masks forever? I don't know. Will
That's
we need to have a COVID test for wherever we travel? I mean, some countries are not allowing us to enter their country unless we have a negative COVID test. So, I mean, I'm just wondering how the world will completely be changed. But anyway, we have a couple of more questions. And I don't want to neglect the fans. So, Dr. Yas wants to know, she's heard that it can make you become sterile. Any data on whether the vaccine can cause you to become sterile?
So, right now they're doing clinical trials for pregnant women. And so they have completed the trials on animals to look at if there are any implications for fertility and, childbearing. And the study cleared animals has now moved into people, into humans. That's always a good sign that there were not significant side effects. Much like the flu vaccine. So the flu vaccine is recommended for everybody 6 months of age and older, and it is especially recommended for pregnant women who are a highly vulnerable population. And we know that the flu vaccine, when you get it, does protect your fetus. I think that ultimately pregnant women will get the vaccine. They will be recommended to have it, and they're going to be a highly vulnerable population that probably will get the vaccine in the future before other people. So to answer the question of regarding sterility, I have not heard that. I do not think we have data to support that. I understand that concern, and I think that is such a devastating thing to think about as a side effect from the vaccine, but I do not think that is true. I think that is urban legend and myth and not fact. In the process of the rollout of these vaccines, I think I've seen a lot of stuff on social media and heard a lot of things from my patients, and I don't know where it comes from. And so I think as we discuss the vaccine and the complications and side effects, benefit to risk, you really have to look at the source of your information and make sure that you fact check and that you ask your doctor and ask again and read about it yourself. But that, really important question. But the answer to that question is no. I don't think there's sterility associated with the vaccines.
So I think we have one clarifying question, and that is, if you get the vaccine, does that mean that you cannot get COVID-19 again?
So I think the jury is still out on that. I think you are protected for an unknown amount of time from severe to moderate infection. The variants that we see coming out of the UK and South Africa are more transmissible, and right now they're not considered to be stronger or more virulent, but who knows in the future if there will be other variants that the vaccines don't protect against. If you think about the flu vaccine and the flu and how that process works, the flu virus shifts and drifts and changes from year to year. And so they change the flu vaccine each year to reflect those changes. I think, moving forward, we may see that same type of change in the COVID virus or the SARS-CoV-2 virus. And so, that is to say that just because you've gotten the vaccine this year doesn't mean that, you're going to be protected for years to come. We probably will have to be revaccinated, and you should anticipate that there will be an expiration date on your immunity conferred by the vaccine.
Okay, I'm just checking to see if I see any more questions. You guys have great questions. And I just want to check the time. Are you good on time, Dr.
Oh,
Joy?
yeah, I'm great.
All right, let me see if there were any that came in before. I think we've covered the vaccine. You've covered COVID-19 in kids and going back to school. That was great info. I know there's a lot of angst with the vaccine, so hopefully, I'm just checking to see. Let's see. Okay. Yes, there were questions about the mask. We did answer that. So I'm just going to check anything on your end, Dr. Joy. Anything else that you want to share? Any interesting cases or anything maybe that you see from day to day? Anything that you think our audience would be interested in?
Yes. So, one of the things that I am particularly interested in is vaping in kids. And one of the things that I wanted to mention is that, again, overall, kids have not been as severely affected by COVID-19. But one of the things I have seen is a higher risk population, kids that vape or that have vaped in the past or who smoke. So, if you know of any kids that are vaping, if your kids have dabbled in vaping, and sometimes you don't know, really important that you're talking to them about quitting smoking, quitting vaping. If you're vaping or smoking, you definitely want to stop that. There was a study out of Stanford that showed that kids who vape and young adults who vape are 7 times more likely to have COVID-19 that is moderate to severe in presentation. And so a lot of the kids that I'm seeing that have had more severe cases of COVID-19 with pulmonary complications and more asthma-like symptoms after their illness with COVID-19 is over, they are kids who are former vapors or who are currently vaping. And so I think there will be more data out on that, but that's just something I wanted to highlight.
Okay. That's very, very interesting. And I have another question. And Beverly wants to know, what do you suggest for helping your immune system? I can share a little bit about that just from a allopathic natural,
Yes.
preventive side, and then I'll let Dr. Joy. So, well, I mean, just one, get plenty of sleep. These are actually a lot of common sense things that we don't actually think about. Decrease your stress levels as much as you can, exercise as much as you can. Hand washing is huge. We don't realize how many germs we kill with soap and water. Soap and water when you can, and if you can't, hand sanitizer. And as Dr. Joy said earlier, mask up and social distancing. That is actually huge. And then some other natural things that you can do. The big vitamins that we've been pushing are vitamin D, which our community does not get enough of. One, because we don't go outside as much anymore. It's winter. And two, we have our melanin. Because of our melanin, we don't absorb as much of the sun, that natural vitamin D that we would get. And then vitamin C and elderberries, huge. I mean, I thought it was just this fad, but turns out there's some data to support that elderberry is a good natural. So those are my big three: C, D, and elderberry. But what about you, Dr. Joy?
So I second everything that you said. I was going to mention sleep. Sleep is really core to the normal functioning of a person. And certainly for kids, sleep is really important. I've seen a lot of kids that have had almost like a reversal of their sleep-wake cycle. They have their days and their nights mixed up. And so they aren't getting efficient sleep. When you haven't slept well, you're more susceptible to infections. So I do recommend, if your child is up because they're in virtual school, they're playing video games overnight and getting up right before school starts at 9:30 or whenever, try to get them back on a regular sleep schedule. Totally agree with the supplements you recommended. Vitamin D has been a major vitamin that's implicated in lung health. And so vitamin D, really important to supplement. People of color definitely need higher levels of vitamin D. And then over the winter, most people may become vitamin D insufficient or just deficient. And then garlic, anti-inflammatory.
Mm-hmm.
So something to consider, for flavor, and then, has some anti-inflammatory properties. But then everything else Dr. Terralon said, I co-sign.
Okay, so let's say if someone is positive, so Jeffrey wants to know if someone is positive with COVID and is a smoker, can the smoke that they carry, um, I guess he's asking, can the smoke that they carry while they're smoking, can they transmit the virus while they're smoking and blowing smoke into the air?
Really good question. Absolutely. And, the way I explain it to my patients is, and a lot of my patients are very susceptible. They're asthmatics and they're really susceptible to smoke exposure. I am too, by the way, as a severe asthmatic. So if you can smell smoke, that's because, whatever droplet is carrying that smoke particle in the wind, in the air, has made it to your nasal receptors to absorb and to process and for you to sense. So included in that smoke can be aerosolized droplets of COVID-19. So if you think about how far away you've been from somebody when they're smoking and you can smell it, then you have to think that if they are actively shedding the virus, and the sneaky thing about the SARS-CoV-2 virus is it's going to affect your nasal epithelium, your nose, and be shedding for 2 weeks before you experience symptoms. So you can be unknowingly very actively transmitting the virus. You're smoking, you're vaping, you don't really think you're causing any trouble, but you are a super spreader because the smoke that you're exhaling, the vapor that you're exhaling is going to be infectious. So yes, absolutely. And in that study that I mentioned about vapors in Stanford, these were kids, 16 to 24. That was really the primary mode of transmission amongst the vapors. It was the exhaled vape that included the aerosolized droplets, and that's how COVID-19 or SARS-CoV-2 virus is spread through aerosolized droplets. So if you have smokers in the family, you want them to smoke outside, not inside. You want to make sure that if they're coughing, they're covering their cough, they're wearing a mask, washing their hands and their face, and as always, trying to quit smoking.
Okay, awesome. Let's see. Trying to, because some of these you cover, your answers are so thorough that you're covering a couple of the questions at one time. So just want to make sure I'm not repeating, but trying to give everybody a chance. Okay, Lauren says, this is our resident EMT here.
Oh, nice.
Lauren is saying, can you maybe speak about the risk or benefit continued primary care? I run into a lot of patients who seem to have stopped going to their GP, so their general practitioner, especially those with diabetes and hypertension. I'm getting an argument with me on that, but go ahead.
Yeah, so thank you. And her name is Lauren.
Uh-huh.
Oh,
Lauren.
thank you, Lauren, for, you're on the front lines. Thank you for all that you do, for taking care of the patients, bringing them to us in the emergency department in the hospital. We so appreciate you. So as far as general care, we have seen a major decrease in the volumes of patients returning to their primary care providers for their routine care, their vaccines for young children, for patients who we have followed for high blood pressure, for diabetes, for whatever ailment they have. They are not coming back. They're scared to come to their doctor's office because they think they're going to get COVID-19. They're scared to go to the emergency department because they think they're going to get COVID-19. The thing that I want to impart is that if you have an underlying condition that is not well managed, it's going to make you higher risk for COVID-19. So it's important that you continue to follow up with your general practitioner, that you maintain your child's routine vaccinations, that if you have something that's bothering you, a chronic pain or ache or cough that's come up, lump somewhere that you felt, you get it checked out, because we're seeing kids present with more severe complications from routine infections. We're seeing adults present with more advanced cancers. We're seeing people who go months with high blood pressure that's not treated, and they have end organ damage, problems with their eyes, with their limbs. So we want to make sure that we're not sacrificing our overall health due to concerns for COVID exposure.
Awesome. And I think we'll make this the last one. So Beverly asked specifically about, and I think I got, hi, Lucretia. I think we covered Lucretia's question with COVID-19 and vitamin D deficiency, because you covered vitamin D's important role in lung health. And with Beverly, she wanted to know what strength of vitamin C and vitamin D. So for me, I was just going to recommend as far as D that you actually get your vitamin D level checked.
Mm.
So that should be prescribed by because what generally happens is all of us have, I shouldn't say all of us, I don't know that for sure, but many of us have low vitamin D levels when they check our active levels of vitamin D.
Mhm.
And so then your primary care provider should prescribe you vitamin D based on your level. For vitamin C and elderberry, I would just follow the instructions on the bottle. What about you, Dr. Joy? You have anything different?
No, I recommend the same. That sounds great.
Okay. And I think that's about. You have any closing remarks, Dr. Joy?
Just want to thank you for doing this. I was mentioning to Dr. Terralon that I've watched her live streams before, and she's so inspirational and informative. And I'm so grateful to you for hosting this because this is such an important topic. So thank you for having me. And, I encourage you to continue so we all learn.
Well, this was fun for me, and it's really important, one, that we get the message out there, we get the info out there, and for me, it's really important that representation matters because kids can't see. I mean, kids can't be what they can't see. And so for me, I know that was important for me growing up. I had considered becoming a nurse, but it wasn't until I actually met my first pediatrician who was a Black woman, and I thought the idea never occurred to me.
That's
And
so
so that's when I really started working, and I never stopped. I never veered from that goal of becoming a doctor, but it wasn't until I met her and I thought she was just amazing. I still remember her. So it's really important, and to think that we only make up 2%. It's again, our community really does depend upon us. Not just as communities of color, women, just we bring so much to the table and we love what we do. So it's really important. And then you and I, especially because we have a special interest in not just practicing traditional medicine, but also exploring other areas of medicine that are not so traditional. I mean, you have this wonderful interest in asthma, and you take it a step further and you have designed this wonderful product for your kids. I mean, you saw a need and you thought, okay, well, this is more convenient. I want kids and parents to have this so that they can manage their asthma better. And I thought, I mean, what a boss move. I mean, I mean, people like you inspire me. And so I want other people to know you. And so I just love sharing positivity and spreading that kind of knowledge to other people. So you inspire me, and thank you all. Thank you to all of the viewers. I love your questions. Whenever you guys ask questions, then I learn as well because we don't know everything. We're still learning. We are a global community. And so I just want to encourage you guys in this time to spread a little kindness, no matter what your job is, no matter what you do, whether you're a teacher, whether you're EMT, whether you're an accountant, no matter what you do, whether you're a janitor, just whatever you can do during this time, just spread a little kindness and be well and take care of yourselves. Take care of yourselves so that you can take care of others. But that's all that I have. So I'll let you close it out, Dr. Joy, with your intro, and then I'll introduce myself one more time. Maybe you want to tell them about your go bag, and then I will close out the broadcast as I check the chat.
Yes. So I'm Dr. Joy Lucas. I'm a board certified pediatric pulmonologist or lung specialist for kids. I help kids and their families successfully treat asthma symptoms through innovative products and educational tools. I've created a product called Asthma Kid Care Go Bag to help kids with asthma keep their medicines organized and ready for use. You can visit www.asthmagobag.com to learn more, and you can follow me across all social media at Dr. Joy MD. That's dr.joymd. And thank you so much for having me, Dr. Terralon.
Oh, thank you for joining me. I know you're really busy, so thanks for taking the time out. So thank you guys. I was just checking the chat. If any other questions pop up, then I'll send them over to Dr. Joy if I can't answer them. But thank you guys so much. We really do value your time, and we know that you could have been surfing the web elsewhere or watching TV. So thank you for joining us. We wouldn't be here if we didn't have an audience. So we appreciate it. So I'm Dr. Terralon, your board certified family physician, speaker, author, and coach. I help medical professionals make pivotal changes so that they can live a life of flexibility, freedom, and financial independence. You can follow me on all social media at Dr. Terralon. That's DrTerralon. And you can actually schedule a strategy session with me if you're a medical professional and you're thinking about changing professions, or you need to make an adjustment, or you just need some coaching. I'm here. So you can go to medicalcareerpivot.com and get my tips there. There's a free video. And then at the end of the video, then there is an email address there to contact me. So thank you guys. Good night, and continue to send your questions. We appreciate it. Bye.